I'm Barrett Rollins. I live in Boston, the city of Boston. I'm an oncologist and a researcher at Dana-Farber Cancer Institute, and I've been here at the Institute for over 30 years. My wife had an acute episode in September of 2012. She had a massive pulmonary embolus in which a blood clot moved from lower extremities into her lungs. This was a major catastrophic event. She essentially underwent a cardiopulmonary arrest at that time and was brought to the intensive care unit at Brigham and Women's Hospital, and we came to understand that the reason for this blood clot, as in other patients, was the result of widespread breast cancer. As it became clear that she was going to be suffering from some very specific and difficult issues, mostly around breathing problems, respiratory problems, we wanted to be hooked up with hospice. And I must say that in many ways it was one of the smartest decisions we made in terms of her overall care. When it comes to the clinical expertise that hospice was able to provide, I was a little bit pleasantly surprised, I have to say, that I thought that at best we would be given a lot of help around symptom management. And I say at best, but I mean that's a lot right there. But what I found was that the hospice physicians were able to talk to me and my wife in a way that was extremely comforting. Our physician was a very sophisticated individual, both in terms of primary disease processes as well as providing palliation. And she was the person that I think gave more comfort to my wife than anybody else. What we appreciated was Dr. Patel's understanding that what Jane needed most was a rational, sort of evidence-based approach to how we were going to deal with the end. To have the 24-hour hotline available for us, if Jane woke up in the middle of the night and was having trouble breathing and I couldn't sort of suppress her concerns by dealing with the pump, to be able to call the hotline to get a nurse on the phone was incredibly comforting. I will tell anyone who listens that hospice is one of the great inventions of Western civilization. I almost sound like a cult member, but I think when it comes to providers, I'm again in a privileged position here, and I'm trying to have some of my colleagues understand just how profound the benefit can be. I just cannot say enough about the importance of hospice in Jane being able to have a comfortable end. Families need to understand fairly early on in their disease course whether or not they're dealing with a curable disease. And by the way, this is again one of Jane's major research areas. But they need to understand what's curable and what's not. Begin the conversation about hospice early. Don't have to engage hospice right away, but the earlier you talk about it, the less traumatic it will be to make the decision and the more welcoming the decision will be. People have to understand that, again, hospice is not, okay, we're closing the door, okay, this is it, okay, we're throwing in the towel, okay, there's nothing more to be done. It's a different phase in the care of somebody with a terminal illness.